What's up, guys? So my name is Justin Parker, and this presentation is on muscular dystrophy. So just a quick overview of muscular dystrophy. So there's multiple muscular dystrophies. There's actually more than 30 different types, and it's a genetic disease characterized by progressive weakness and degeneration of skeletal muscles that control your movement. So there's different forms, and they're seen in infancy or childhood, and some other different forms might not even be found until middle age or later. So with over 30 different diseases, there can be various effects on the body, and they can affect the skeletal muscles and the cardiac muscles. So this is just a little image to show you some of the different forms of muscular dystrophy and the different parts of the body they affect. And the most common is the Duchenne and Becker types of muscular dystrophy. So then this is just talking about the prevalence of the disease. So muscular dystrophy varies from every different form how likely it is. And this isn't a disease where everyone who has it has the exact same symptoms because they all affect different things. So the most common form, as I said, is Duchenne and Becker, and that's most common in children, and it affects every 1 in 5 to 6,000 males aged 5 to 24. So the most common for adults is type 1 myotonic muscular dystrophy, and that affects 1 in 8,000 adults. So just going into some more details, there haven't really been many strides made in research on the muscular dystrophy front until the 80s, and then in 1986 they actually discovered that muscular dystrophy was carried on the X chromosome, and when it's mutated it causes various different forms. So just a history of like how you can get it and some details. Males have both an X and Y chromosomes, but females have two X chromosomes. So since this disease is a mutation on the X chromosome, if a male has it, they automatically have the disease because their only X chromosome is mutated. But since females have two X chromosomes, then if one's mutated and the other is not, they won't actually have the disease, they'll just be a carrier, and they need to have both mutated to have the disease. So what it means, if they're a carrier, they can pass it on to their children, but they won't actually have the disease themselves, and they won't have the symptoms. The only thing they might have is that they're at risk to have cardiomyopathy from it. So that was more of the genetics on it, and then some causes. Yeah, again, it's the X chromosome that's mutated, and the mutation that happens affects the dystrophin production on the X chromosome. So muscular dystrophy is caused when there is a mutation to the dystrophin, and that gene fails to make functional dystrophin. So the severity of this mutation can be different from which type you have, and that's why there are multiple types, because there's different mutations of that gene. So what is dystrophin? Dystrophin is a protein that transfers the force of a muscle cell from inside of the cell to the cell membrane. So a lack of dystrophin can cause many negative effects on the muscles, and it also transfers the force of the muscle and holds the molecules in place near the cell membrane of the muscle cells. So failing to have enough dystrophin in the body causes muscle weakness and progressive damage and weakness to the muscles. So just some ways that you can diagnose the muscular dystrophy, or some signs of it. Muscular dystrophy is typically diagnosed when you're between 2 to 5 years old, and some signs are diagnosed when watching children run or like stand up from sitting on the floor. One very common sign that helps people diagnose it is called Grower's sign, and it's when people stand up, they almost lean on their legs to help them stand up and push through their thighs. And this little image is showing like what that looks like and how to diagnose it. Just some more on diagnosis. The first step in getting diagnosis is getting an exam with a healthcare provider, and then they'll go through various tests to see the cause of the muscle weakness. So they might not do all these tests, but some tests they could run on their path to finding it are blood tests, muscle biopsies, genetic testing, neurological testing, heart testing, exercise assessment, and image testing. So yeah, again, these tests might not all diagnose muscular dystrophy, but they might rule out other possibilities, or if it isn't muscular dystrophy, they might test for something else, and that might be the cause. So for muscular dystrophy, the most effective test that they've been doing is muscle biopsies, and that's where they actually take some of your muscle tissue and examine it for the genes that cause muscular dystrophy. So this is just a little chart showing the different ways that you can diagnose muscular dystrophy. So age 2.5, the first sign of symptom will be noticed, and then by age 3.5, they'll actually be taken to the pediatrician for an evaluation, and by age 5, usually, they'll have a diagnosis either from a DNA test or from the muscle biopsy. And it usually takes about 2.5 years to make a final diagnosis on this. So just some symptoms on muscular dystrophy. The main symptom is progressive muscle weakness, but there's more symptoms than that. It's not limited to just muscle weakness. So other signs and symptoms, which can begin as early as 2 to 5 years old, include frequent falls, difficulty standing up, difficulty running and jumping, waddling gait, walking on the toes instead of the balls on the feet, enlarged calf muscles, muscle pain and stiffness, learning disabilities, delayed growth, and possibly cardiomyopathy. So Duchenne and Becker are the two most common types of muscular dystrophy, and they have similar symptoms, but Duchenne is much more severe and progresses at a faster rate. So they actually have the same muscle weakness and degeneration, but usually Duchenne is a little faster and more severe. It's also very common to be in a wheelchair by like your teenage years when you have muscular dystrophy. And this little chart showing how common it is at each age to be in a wheelchair. So usually when you're between 5 and 9 years old, it's not that common, only 30%. Getting into like your 10 to 14 age, it's actually really common, up to 82%. And by the time people with this disease are 15 to 24, 90% have it, so almost everyone. So just for some treatment of the disorder, there's no known cure for muscular dystrophy. Treatment is aimed towards controlling the symptoms and just improving your quality of life. And experts have gone back and forth as to whether exercise has a positive or negative impact on the patients. I think most at this point will say it has a positive impact. We'll get more into that in a bit. So this is just how muscular dystrophy affects exercise. So it's muscle weakness and degeneration, so it's obviously going to have an impact on that. So the weakness of your muscles obviously makes it harder to work out, makes you get more tired. So patients that actually have muscular dystrophy have trouble with the following. They fatigue more easily due to muscle weakness. They're more likely to get injured. They're unable to exercise for long periods of times. And just a way to help all these things is improving fitness. But again, that's a struggle to do because of the muscle weakness. It's hard to actually exercise for long periods and gain strength. And then on the other hand, this is how exercise benefits muscular dystrophy, and this touches on how people weren't sure if it's positive or negative. So it does have many benefits, but you also have to be really careful when you have it. So because of the muscle weakness, you have to exercise at the proper intensity, and if you do that safely, the following benefits it could give is reduced fatigue, improved bone density, improved sleep, and maintaining the ability to perform everyday tasks by slowing muscle loss, and that actually slows down the degeneration as well. And this was a study on the benefits since they weren't always too sure. They were trying to get more details on that. So obviously there's not a problem for exercising for your heart and your cardiovascular system, and that's why they think that it is a benefit. It's just they had to see if those benefits outweigh the negatives of hurting your body with this muscular dystrophy. So there was a study by Northwestern last year, 2019. They tested mice with muscular dystrophy and they examined their response to different intensity levels of exercise. So they concluded that exercise at both low and moderate intensities was beneficial, and that the mice did not increase muscle damage or muscular fibrosis due to the exercise. And while it didn't hurt those aspects, it actually improved their skeletal muscle function, reduced cardiac decline, and it increased their respiratory capacity. So they concluded that moderate intensity was the most beneficial, and then low intensity was the second most beneficial, but they both resulted in the mice being more active in their like daily activities than they previously were before this study took place. This is just some exercise guidelines for those exercising with muscular dystrophy. So too much exercise can overwork the body, and it can actually harm the muscles with this disease. So ideally, patients should exercise up to 20 minutes a day and 4 to 6 days a week. So according to healthfully.com, exercise when suffering from muscular dystrophy can include aerobic exercise up to 65% of heart rate max, strength training with low rate and high reps, and stretching to help with flexibility and joint stiffness. So the medication that helps with muscular dystrophy might have a little bit of an effect on exercise, so we just went into some details and figured out if that actually does do anything. So while there's no cure for muscular dystrophy, you can obviously take medications to help maintain your muscle and slow the loss. So what the most common thing that's been taken is corticosteroids, either prednisone or deflazacort, and they've both shown that they help delay muscle loss. So in recent years, they also discovered that you might be able to take eteplirsen and galortazine, and they've both been approved by the FDA, but they only treat specific types of muscular dystrophy, so it just depends what you're suffering from. And since corticosteroids are the most common, I just went into some research on the exercise response to corticosteroids, and it actually helps. It improves your strength, pulmonary function, and time motor function. But on the other side, some side effects is it may cause irregularities in potassium and phosphate levels, which could both lead to high blood pressure or irregular heartbeat. And then getting into the case study. So the patient I created, I'll just read his little profile. So Shane is a 12-year-old boy with Duchenne muscular dystrophy. He was diagnosed at age 5. He's 76 pounds, 56 inches tall, and he has a BMI of 17. This BMI places him in the 36th percentile for boys, so he's definitely on the lighter side. He has no other risk factors. He has exhibited no signs of cardiomyopathy yet, but still should be monitored as he ages. He has a heart rate of 77 beats per minute, blood pressure of 110/67. His cholesterol is 150 milligrams per deciliter, LDLs is 108, and HDLs is 48. So Shane has never played sports, and he's been relatively inactive due to his muscular dystrophy diagnosis. He's on prednisone to help delay muscle loss, and his goal with this program is to improve his fitness levels and strengthen his muscles to help improve his functioning of daily activities of living. So just a quick conversation I would have with him before beginning the program. I would just tell him what the program is going to look like, and I'll explain to him the challenges and modifications he will face due to his muscular dystrophy diagnosis. I'll let him know that it's not due to his medical complications. Exercise testing will be necessary before beginning any actual exercise, and due to his medications, he's at risk for having high blood pressure or irregular heartbeat, so that's something we'll have to monitor as we continue through exercise and test during his exercise testing. All of his levels are relatively normal, so he should only be restricted by his muscle loss, and obviously that's still going to be a big impact. And I'll explain that he will not gain muscle at the same rate as an unaffected individual, but he will still work and make progress. And I'll explain everything that this program will entail and ask if he has any questions to make sure we're on the same page before beginning. So just some exercise testing we would do before going into the program. To test his balance, we would do the 4-stage balance test, and this would test if he has any muscular imbalances that could possibly cause any injury while exercising. And before moving into aerobic and strength testing, we want to see this because it could be a big risk for injury, and this 4-stage balance test progresses to harder and harder positions, which test different muscles to give us a pretty good overall gauge. The next test would be an aerobic test, and I'll just have him do a 1-mile walk test. This can allow me to test his heart rate and blood pressure and see how his body responds to exercise, but it will also keep it at a pretty low intensity, so there's no risk, and I can get a pretty good baseline on a simple thing before moving into like a running mile test or something like that. Then finally, for strength training, I'll do a push-up test. This will keep it as a body weight test to limit his risk of injury, and he will just see how many push-ups he can do with proper form or until failure. Finally, we'll do some flexibility testing, the sit and reach test, just to test his back and hamstring flexibility and make sure they're not going to cause injury when moving into real exercise. So for the fit principles of his exercise program, he'll train 5 days a week, 4 days a week of cardiovascular training, and 1 day a week of body weight strength training, and he'll begin every exercise with a warm-up and a cool-down. Intensity, he'll keep it a pretty low intensity, 50 to 60% of heart rate reserve. Due to his muscular dystrophy, we don't really want to get into too much intensity, and this will keep those levels too low that he won't get risk of injury. And then for time, he'll do 20 minutes per exercise bout, increasing gradually to 30 minutes a day as his fitness levels and strength increase. So the type of training, we'll do cardiovascular 2 days a week of walking, 2 days a week of biking for 20 minutes for each. Resistance training, he'll do 1 day a week of full body training with body weight lifting. He won't use any weights because of his muscle weakness. And then for flexibility, he'll do stretching every day with a warm-up and cool-down. So modifications, he just has to make sure that he does everything a little bit lower intensity than everything else because of his muscle weakness. So it does have benefits, but it also comes with the risks. So he'll have to be extra cautious to avoid injury. He'll keep his intensity very low, walking and biking, no actual weights when strength training. So just overall, muscular dystrophy is a really serious disease, and it degenerates your muscles and ultimately leaves many in a wheelchair as they get older. Duchenne is the most common type of muscular dystrophy, much more common in men than women. And finally, exercise is very beneficial, and while it does help those suffering from muscular dystrophy, it definitely has its risks as well.